Hello and welcome to the Forever Fit with Carol Covino podcast. I'm your host, Carol Covino. I'm a health and fitness coach for women over the age of 40 who are struggling with perimenopausal and menopausal hormonal symptoms. I help them to lose the body fat for good and to tone and strengthen their bodies. Today on the show, I have with me a special guest, Hannah Wind. Hannah has a lifelong passion for longevity and breakthrough disruptive technologies that drive radical improvement to the human condition. She attended the University of Kentucky and graduated with a degree in biology. During that time, she had multiple research internships studying cell signaling and cell biology. After graduation, she worked for the International Peptide Society as their Director of Research and Content. Through work in the integrative medicine industry, Hannah saw an opportunity for methylation based age diagnostics. And this is when she started True Diagnostics in 2020. True Diagnostics is a company that focuses on methylation array based diagnostics that are used for life extension and preventative healthcare serving functional medicine providers. True Diagnostic has a commitment to research with over 30 approved clinical trials investigating the epigenetic methylation changes of longevity and health interventions. Since True Diagnostics' inception, they have created one of the largest private epigenetic health databases in the world, with over 15,000 patients tested to date. Hannah has since created Everything Epigenetics, where she shares insights on how DNA regulation has an impact on your health. I hope you enjoy listening to our conversation as much as I enjoyed recording it. Welcome to the show, Hannah.
Yeah, thank you for the introduction, Carol. I really appreciate it. I'm excited to be here and chat about, hopefully all things epigenetics.
I'm excited to dive into this subject. This is something that has interested me for some time. But before we get started, can you explain to the listeners what is methylation age, or excuse me, based age diagnostics?
Yes, that is a great starting point and definitely a loaded question. Methylation has been around for quite some time, and when people really hear the word methylation, they typically think of the MTHFR gene or the COMT gene. When you think of methylation and epigenetics, we're talking DNA methylation. And that essentially is just a marker on top of your genes, on top of your DNA. The word epigenetics actually has this Greek prefix, epi, meaning above, meaning on top of the genome. And if you have those markers, if when we say if something's methylated, if it has a CH3 group, if it has a methylation marker on top of it, that gene expression is actually being silenced. So you're not getting that central dogma, you're not getting that phenotypic outcome, and vice versa. So if it's unmethylated, if you do not have that CH3 group lying on top of your genetic infrastructure, then you are going to get that central dogma activated. You are going to get that phenotypic outcome. And it's really important to differentiate. A lot of people, when they think of methylation, they actually think it's really bad because their mind is going to that MTHFR gene again. And in our case, we want some things to be methylated, some things to be turned off, and we want some things to be unmethylated, some things turned on. And a really great example I like to give is going to be cancer genes, your oncogenes. We want those methylated, we want those shut off, but we want our tumor suppressor genes, for example, things that are going to help overcome cancer, turned on. So, in a hopefully very summarized fashion, that is really explaining what DNA methylation and what epigenetics is.
Wow, it's so interesting to me. So, what are the things that would turn on cancer genes and turn them off?
Oh yeah, all types of different things. I really like to start at almost what I call this totem pole, the bottom of this totem pole, or you can even look at it as like a pyramid. I really think where we need to nail down as just just the human species is our lifestyle factors, right? And lifestyle factors, there's a plethora of different, I would say, groupings you could dive into. Um, One that I really like to talk about is stressors, right? So any type of stressor is going to shift those methylation markers in an unfavorable way. You can even think of things like your diet. It's all about the calories you're taking in, right? You want quality foods, whole foods, no artificial flavorings. There's a difference between going to McDonald's and getting a Happy Meal, right? And eating, a salad that was homegrown in your backyard in your garden. Some other additional lifestyle factors that I want to mention are also going to be fitness, which I know is a huge part of what you help your patients out with. Moving your body, keeping on that muscle mass as you become older chronologically. And the last main one I would say that we really discuss is going to be sleep, having quality sleep and quantity sleep, right? Sleep is a skill. It really protrudes every other aspect, every other area of your life. And I would say some other subcategories that many people talk about is, of course, keeping a healthy weight, right? That has a major effect on turning those epigenetic markers on and off. We can also talk about, smoking and drinking. Neither of those are going to obviously have a good effect on your epigenetic methylation, thus increasing your biological aging, being that main outcome that people relate with. And then the last one being pollution exposure, any type of toxics, and this is becoming huge. And I would say what we call our space, this functional preventative integrative space, where I recently heard women in particular put about 175 different toxic chemicals on their face, from their skincare to their makeup routine to their shampoo and conditioner. So there's a load of ways we can actually detoxify our environment and surroundings. And that's what I mean about pollution, right? We have our air pollution too, but it's not as easy to just pick up where we live and move,
Right.
quote unquote, better.
Right, right. Now, when you're talking about stress, does that include emotional stress or is that hard to measure?
I would say, yes, it does include emotional stress is the easy answer. However, that's definitely hard to measure, right? There are ways that some researchers and experts in the space have studied this by looking at different levels of polyvictimization, especially in children. So, the higher the victimization level, the higher the aging rates, or the higher the biological ages. So that's sort of a way that they can quantify that. There are ways, different people who have PTSD, and have, gone through different events in their life. So if they have that as a diagnosis, we also see increased biological aging and stressors as well. And, I would say depression, anxiety may all fall under that emotional, stressor category too. So we know anxiety and depression can actually cause those biological age clocks to tick a little bit faster too. I'm a naturally stressed out person, so I always find that super interesting. I've looked through the literature plenty of times. Um,
Oh, I love it. I am too.
so
That's why I'm
exciting
laughing.
thing, yeah. Um, Exciting thing is though, these markers are changeable, and I'm sure that's something we'll dive into. But with the stressors, things like relaxation responses, listening to music, even those are free for you to work on, as a part of yourself, as a part of your being, to again help you lower those biological aging numbers.
Yeah, I think even holding a pet, because I know that calms me down a lot of times. I'll pick up my dog and it's just like this instant calming effect.
Yeah, absolutely. I've seen your dog before when we've talked, previously. I
Oh, she's
have a
cute.
yeah, love my dog as well, and definitely think there's something there. I'm not sure if they've actually done any studies with the closeness, the relationship with pets, or people care more about their pets than they do other human beings. So there has to be something
Mhm.
there.
Yeah, I know they use it with PTSD therapy. So they'll use horses, I think dogs, but I'm with you. I haven't seen any studies on this. What do you think of the studies? And this might be veering off a little bit,
Sure.
but I've seen studies where it says it can actually change, PTSD can change the gene expression.
Yeah, exactly right. And by gene expression, they are talking about epigenetic methylation. So it would be, interesting to find out what exact genes they were looking at, because that segues into the question, what's the difference between genetics and epigenetics, right? That's just a really important kind of basic fundamental
Mhm.
question we can ask. And remember, your genetics are your genes. They're not going to change unless you're doing some crazy gene editing or CRISPR or something of the sort. Your genes in your eyes and your heart are the same. But your epigenetics are, again, going to be changeable. They're going to be those on and off switches in expression, like we talked about previously in this conversation. So those are going to be the markers that we discussed, and those are going to be changeable. So when people say, that the gene expression is being changed, that's really another way to talk about or say epigenetic methylation.
Yes, yes. So interesting to me. Now, you talk about biological age. So, what is the difference between our actual chronological age, biological age? What are the differences here?
Yes. So remember how we're getting this biological age is we're interpreting those epigenetic markers, those DNA methylation markers I keep rambling on about. And the difference between chronological age and biological age is chronological age is your birth date, right? It's how many candles you're blowing out on your cake every single year. And biological age is really going to be the age of your body at a cellular level, at a cellular mechanism. And that is so important because chronological age is not a good marker, right? We all know people who are 30 that look like they're 50 on the outside, right? And vice
Mhm.
versa. So that's the idea of phenotypic variation. So we needed some other type of biomarker to read how your body is aging at that cellular level. And that's where biological aging came in. And it's so important because if people have accelerated biological aging, so biological ages that are above their chronological age, they are at risk for almost every single chronic disease and death. So we know biological age is this better predictor. That's really where it's epigenetic methylation is getting its I would say fame from. Is it being used to predict all of these different age outcomes?
Now, do you find that sometimes people are afraid to do this testing? Because I've mentioned it to women, and they'll say to me, "I'm not sure I want to know."
Oh, all the time. There's a more popularized, I would say, outcome out there called grim age, which is essentially a death predictor. Um, I'm the type of person that wants to know everything, so I'm game for
Mhm.
that. But when we do offer some people these kits, I always want to be very conscious of them, and I say, some people don't want to know. If you don't want to test, that's completely okay. To those who are a little bit on the fence, maybe they're in between, they're not a full no, but they're like maybe. I always encourage, maybe just start out testing a couple markers. Don't get the full panel, right? Dip your toes in the water. See how you feel about it. And number two, I give them the reassurance that these markers are changeable. So if you see some results that are unfavorable, you can make changes. Most of it is in your control, right? You see a lot of sayings that are like your DNA is not your destiny, or your genetics
Mhm.
can now change, things like that, and they're referring to that DNA methylation.
Now, how young should have someone have this test for the first time, do you think?
Yeah, that's that answer becomes a little bit difficult. Easiest, I would say, straightforward answer is you can test as young as possible. Aging really starts at our inception. So I really encourage people even in their 20s or 30s to test. Um, I always tell my healthcare providers and everyone I speak to, it is a heck of a lot easier to prevent rather than intervene when the disease diagnosis has already
Yes.
happened, right? Because if you have organ damage from a disease, if you have a phenotypic outwards expression of some type of disease, chances are you're not going to be able to reverse that fully. So we really want to address it at its core, catch accelerated aging as soon as possible. Most people I would say that we test with my company are going to be between the 40 and 60-year-old age group, just because those are the patients that our healthcare providers are seeing, and people who are really interested in this, right? But essentially, easy answer, you can be, any age and start testing this.
Interesting. I wish this had been available when I was younger, even to
Yeah.
do in my 40s. Because looking back, I was diagnosed with autoimmune in my early 50s, but I realized I had the symptoms probably 5 to 7 years prior to the diagnosis, that it was
Mhm.
just slowly, it was slowly, they even told me this is slowly progressing. But by the time it was found, of course, just like you said, it can be really hard to back up, go in reverse, and reverse the effects of autoimmune.
Right, and that's something you said right there is so interesting. The how you said you start to felt symptoms
I
before,
did.
the actual onset. And that is why methylation, if people are listening and there's anything you take away from this podcast right here, it's that methylation is a great biomarker. People really again popularized it from aging, but it is just expected to overtake conventional medicine and your hormone testing, your typical blood panel testing. So what people are doing with methylation, and a lot of the great researchers in this space, is they're identifying, what they call methylation risk scores, basically just a set of methylation markers that could tell you if you have a risk of, a certain autoimmune disease, for example, or cancer or different diseases before you even see the onset of those symptoms. And that's why it's just really special. So there's a ton of research going on in the space right now, for methylation just to be predictors of general disease, that don't necessarily have anything to do with aging.
Now, when I think of methylation, I think of the detoxification pathways. Am I correct with that thinking?
It's you know that is one way to think about it, right? With the MTHFR and the COMT, those are more related to genetics. So we definitely want to clean up those pathways, right? There's a lot of MTHFR testing, COMT testing, where you can get some methylated products like the 5-methylfolate or the methylcobalamin to help you regulate that. And that does play a role in our type of epigenetic methylation we're talking about, right? If you regulate that, you're going to have better epigenetic aging as well. So they're definitely intertwined with one another.
Now, what do you see as the biggest factor to biological aging? Is there one thing that like stands out? And I know it's because working with clients, it's several lifestyle habits. It's everything from sleep to stress to nutrition to exercise, movement. There's so many factors there. But is there one that stands out?
Even though this one relates to me the most, I would still say stress. I would say stress is probably number one. The amount of literature and data that they actually have behind it, which is objective information, is really proving to push that up, and why that stress would be my answer. Just to give you an example, even if you're not a stressed out person, number one, you're very lucky. Number two, um, how you deal with stressful situations could have an impact. So, say you're not a stressed out person, but something happens very stressful in your life. I don't know, you got in, someone got in a car wreck, or something happened. If you can't process that information, and that information as a standalone stresses you out, um, biological age is going up. So even, if stress doesn't apply to you, but it somehow is affecting you or in your daily life, or, um, it triggers a response, you're still going through that mechanism, because our body doesn't know if we just stubbed our toe or someone died, right? You're still going through that same mechanism of action, which is why I think it has such a profound effect on the biological aging.
I think so because when you think about all the things that happen when we're under chronic stress, so there's cortisol and it's a good hormone, we need it, but it's designed to excrete in these kind of acute situations like life or death or a threatening situation. And then when the threat is past, to go back to normal. And I think about the effects of all day sitting in traffic or dealing with a difficult boss or family stressors or your teenagers or whatever it is. And I just think about releasing that continually, chronically, and what effect that has to have on the body over time, and not just with blood sugar dysregulation, cortisol dysregulation, but aging.
Oh, absolutely. Carol, you couldn't have been more, correct there in what you're saying. Um, to dive a little bit more deeper into that, one of the main recommendations based on the literature and what we've seen is, people who take DHEA actually mitigate those cortisol levels. I know that's through supplementation/medication, depending on where you live and how they regulate it. But if people can't get their stress down through walking, reading, writing, or hot yoga or meditation, DHEA actually has seemed to really help with the biological aging. And that compound was actually included in one of the first clinical trials that they did, called the TRIM trial, TRIIM, by Dr. Greg Fay out of UCLA. They used the growth hormone, the metformin, and the DHEA, and they saw about a 2-year reversal. We think most of that reversal in their biological aging was due to that DHEA because of the literature, which supports, a lot of those methylation markers we're testing are on or near glucocorticoid receptor elements. So, you start connecting the dots and it makes a lot of sense.
That's interesting. I had a hormone specialist on the show yesterday, and he was talking about DHEA and how it can help with stress overall.
Yeah.
So that's very interesting.
Definitely. And another side note as well, remember everyone, this is reversible. I just spoke with Dr. Jesse Poganik not too long ago, who actually studied stress in animal models and human models and looked at it within COVID, which is obviously a huge stressor on
Oh,
us,
yes.
um, pregnancy, and then and surgeries. So looked at all these different like stressor markers, which is another interesting way to measure it. And basically he was asking the question, can this be restored upon recovery? And he's out of Harvard, out of the Brigham's Women Hospital. So check out that paper if you're interested. It's a really nice, easy read. But basically the answer is yes. These can all, if we see an increased biological age because of any of those stressors, we can actually push it back down and see it restored. So I want to give everyone hope that's listening out there, right? If you're like me and stressed out, you can definitely work on reversing it.
This is so good for me to hear too. My entire life, and I've shared this with my listeners, anxiety has been an issue for me. I can't remember a time in my life that I didn't experience it. So obviously, I have that kind of vulnerability to be anxious, and I can really, work myself up, stress myself out. And I find that it's more the day-to-day
Yep.
things, the deadlines, things that I have to do. Not feeling there's enough time in my day.
Right. Yeah. I think that's where mine stems from too, honestly, right? It's always thinking, what's next? What should I be doing? What does this person think about ABC XYZ? So there's, like I mentioned at the beginning, just very ever so briefly, I think anxiety and depression and a lot of other mental health, I would say, issues definitely affect the biological aging system. I think it's still very taboo for people to even discuss some of those issues, but I think it's something being addressed or given a little bit more attention to in today's world. So we'll see where they go with those studies and how we can mitigate those effects.
Something that just entered my mind, and it may be off topic a little bit,
Yeah.
but with the epigenetic testing, because I know you'd mentioned, was it 15,000 patients?
Mhm.
Are they all in America or are they international? Because I was just thinking of things like the blues. I mean, I know people in the blue zones aren't getting the testing, but I was wondering, does that make a difference based on where people live, the lifestyle factors?
Yeah, it definitely does. And Carol, what you were referring to, so True Diagnostic, we've tested about 15,000 people to date, one of the, if not the largest, one of the largest private epigenetic databases in the world. But most of those people are going to be relatively healthy. They're optimizers, right? They're
Mhm.
patients of integrative functional anti-aging clinics. But I would say most of them are Caucasians in the US and Canada. However, we do have, some distribution license deals in Australia, New Zealand, different parts of Europe, China. We test people really from all around the world. So as we get that data, people are filling out a little survey when they register their kit saying, talking about their history and their origin and ancestry. We can actually go back and segment based on those different groups and see who has better biological aging. So the data is definitely there. I don't know it off the top of my head, but you're exactly right. With people who are like in the blue zone and eating more of the Mediterranean diet in
Yes.
those
Mhm.
geographical areas. There is literature and there is research that shows Mediterranean diets are actually associated with positive and better biological aging. So a great thought, and that's where you get really more into the population based epigenetics, which is
Yes.
really interesting too.
Having just traveled to Europe in the fall, my husband and I went on a trip, and the Italians just handle stress so much differently than the Americans is what I noticed. That it's there, they acknowledge it, they don't let it take over. I don't know quite how to explain it, but they're a little bit more lighthearted, like, "Oh, this is life," how they approach things.
Yeah, you're so right. It's like the stressors are secondary to them. I was over in Europe probably 5 to 7 years ago or so, and it was great. I've never been to Italy. I want to go back. I'm hoping to go to Greece maybe for my honeymoon in a couple years.
Oh,
But we'll see.
Greece is wonderful. We enjoyed that too. The Italians, I notice, have such a community,
Mhm.
and I think that's part of it too. I feel like Americans go solo a lot. We isolate ourselves.
So great point. And I'll have to pull this paper back up because I haven't looked at it in a while. So don't quote me here, but there are a ton of blog posts and articles and press releases and news and they talk about this research that the feeling of being connected to someone, even if it's just one person, um, it's not about again the quantity of relationships, it's about the quality. So if you have a really tight knit group, or people you talk to and you're very close with, and but each of them you confide in them with different subjects even, those people tend to live longer than those who do not, than those who are lonely, right? So that's another really interesting point. I'd love to read more research up on that too.
Same. I think it makes a big difference. I think as human beings, we are, tribal in a sense, and we're meant to come together into groups and to support one another. And that was something when I was studying the blue zones that I saw quite a bit. I saw certain things in common, a healthier diet, more movement, a lot more movement than what we do, more outdoor, nature, out in
Right.
nature. And then the community aspect was there.
Right. Yeah. I've seen even articles claiming, sitting is the next smoking, or, sitting is like equivalent to a cigarette. Right. I think that's, probably a little dramatic. I'll have to dig more into that data there. But you see a lot of people now, because we're, in the US, we usually do 9 to 5 jobs, but you see a lot of people starting to get the stand up desk, or like the treadmills under
Yes.
the desk, or the little pedaling machines and things. I actually ordered a stand up desk and a little treadmill. It hasn't come in yet, but that was like kind of my Christmas gift to myself.
Oh, nice. Yeah, I have the stand-up desk and I use it quite often just to get up and move around. Because I do working with clients with fitness, you do see a difference in their ability to maintain weight, lose body fat based on daily movement. It almost
Right.
matters more than that trip to the gym. And I'm not saying, don't go to the gym, don't lift the weights, but that daily movement, just getting up and moving around, I think is critical.
Right. Yeah, I couldn't agree more on that.
So I'm going to ask you a question about my testing because I did have
Yes.
testing done, and this interested me so much. There was the gene associated. It was part of the obesity panel that it would be difficult that I don't respond to a calorie restricted diet, and
Yeah.
I thought that was so interesting because I have found almost the opposite with myself, that it's very easy for me to lose weight. Do you want to dive into that a bit and explain it more?
Yeah, definitely. So what Carol is referring to is like it's a great example because it's not an age related report that True Diagnostic offers. It is more of a fun report. It gives you, a little bit of insight into how you respond to a caloric deficit diet. So, caloric restriction, just eating less. And for that, we actually look at the PON3 gene, PON as in Nancy 3. And this is like a little protein gene that's in the bloodstream, and it's associated with high density lipoprotein, so your HDL. But there's about 11 markers, 11 methylation markers that we look at associated to this gene. And based on their methylation, hypermethylation if they're more methylated, or hypo if they're less methylation, we can get an answer if you actually respond to caloric restriction in terms of weight loss. So I want to make that very clear. We love caloric restriction. It's actually one of the, I would say, top recommendations for enhancing, decreasing your biological age, eating less. But some people use it as a weight loss strategy, and not everyone is going to lose weight from it. It's not necessarily about calories in versus calories out, but it's about how you're actually metabolizing those calories. And Carol, like you mentioned, you're going to come out as a non-responder, which means you do not you are not going to lose weight with caloric restriction.
Mhm.
So, that is definitely changeable. Everything based on methylation for the most part, there are some exceptions there, is going to be changeable. So we don't know exactly what changes that yet, right? We'll understand as more people test and we get some before and after data. But when we discussed this previously, Carol, we talked about, right, you also working out possibly, and that may be a reason that it may be a non that you may think you respond to it too, right? So there's some
Right.
confounding factors there, right? Where there may be other reasons that you're actually losing the weight besides that caloric restriction.
Mhm. I'm sure muscle mass makes a difference because it's increasing the metabolism, and that was the first thing that I thought of because I thought back to my 40s before I lifted, and I didn't have a weight problem, but what I did, it was terrible what I did. It was excessive cardio. And
Right.
so I would eat things that I knew I wasn't supposed to eat, and that next day I would starve, and then I'd go run, and I'd train for my marathon, and I did this back and forth, and that was how I controlled my weight at that time.
Right. Yeah. And it would have been really interesting to see your data from that time point too, right? If you would be a non-responder kind of, so there's three outcomes for those listening: a non-responder, which Carol falls into. There's this intermediate responder category. That's in the middle, where you may or may not lose weight with caloric restriction. And then there's the true responder, the full responder, where you would lose weight from caloric restriction. So when we look at this from a population based standpoint and zoom out and look at all the data, you're more than likely going to see a bell curve. Most people are going to fall in that intermediate base section, but Carol, you're a little bit on that tail end there, falling as a non-responder. And it definitely may be associated and correlated with your muscle mass. That would be my hypothesis. But I really like documenting cases like yourself, because again, as we get more of this feedback, this data, this information, we're able to train those outcomes better, or say, maybe it's because of this, your muscle mass in your case.
Yeah, it's just so fascinating. So, with caloric restriction, because I know I've heard this quite a bit, and then we spoke about it being associated with longevity, one of the factors, is that correct?
Yeah,
And
absolutely.
I think about that because the first thing that comes to my mind is who can stay on a caloric restricted diet for a length of time. So I
Yep.
know intermittent fasting is one way you can do this.
Yeah, yeah, it's definitely not for everyone, right? You have to be very, very careful. And it's, essentially the patient talking with their healthcare provider, right? Because calories can be a very touchy subject for people who have eating disorders in the past, or, are not sure how to handle it. You definitely don't want that to trigger anything. And I would say in the world we live in today, it's been so quote unquote Americanized, right? Where eating is great. It's a social aspect, but we're, almost trained to think breakfast at this time, lunch at this time, dinner
Hmm.
at this time, right?
Yes.
And it becomes overfeeding. So one way I really like to talk about this is ask yourself before you even reach for the snack. I have a sweet tooth. I love candy and chocolate. Before I reach for that, asking myself, am I actually hungry? Right? Are you just doing it out of routine, out of your habitual eating habits?
Mhm.
Um, so asking yourself that can really start to help you be mindful of what you're eating. So intermittent fasting, time restricted feeding is a way to, like Carol said, you're reducing the time that you're allowed to eat. So it may help you take in fewer calories, right? Because you're probably full within those windows with eating lesser calories. You could also do, water fast. You could do a 24-hour water fast. I know people who have done them up for weeks,
Oh my goodness.
where maybe they do some bone broth on the side or just some black coffee there. And there's Prolon, the 5-day fasting mimicking diet by Walter Longo. I think that's
Yes.
a good option for people who struggle with caloric restriction because it gives you a plan. It writes everything out. I love a great plan, right? You're following
Hmm.
everything to a T. So those are other ways that you can hit caloric restriction. In the study where we saw it actually helping your aging, it was only a 10% caloric restriction. So, you're doing a 2000 base caloric diet, just eat at a level of about 1800 calories. Like I said, I have a sweet tooth, so I'm always grabbing like a chocolate after dinner or something. So I
Hmm.
just
Hmm.
stop grabbing that. That would be my caloric restriction for the day. But the quality of those calories also matter.
Yes, it doesn't have to be a miserable thing. I find what works really well for me is to do some intermittent fasting throughout the week, then
Yep.
to relax it on the weekend, maybe have a more of a refeed on the weekend. It's
Mm.
not a free for all by any means, but I typically restrict my intake throughout the week. Nothing crazy, like you said, but I dial it in, and then on the weekend I relax it a little bit.
Yeah, you definitely want to be practical as well, right? You can't, I always find, at least for myself, if I'm stopping something cold turkey, or I'm saying, I'm not eating X, Y, and Z, and I'm making these rules up for myself. Then when I do go and I allow myself to get that type of candy or chocolate again, I'm binging, right? I'm eating way too much of it. So just, be patient with yourself, be practical. You understand yourself better than anyone else, and what you're willing to give up and what you're not.
I agree. I think flexible dieting can work in that sense as long as people are making nutritious choices. The mistake I see sometimes is that, oh, it's flexible. I can have cupcakes all day or whatever it is,
Right. Yeah.
taken to the extreme. And I think, working in that piece of chocolate and not
Mhm.
feeling deprived is huge because I know the minute I feel deprived, I'll fixate. I'll start
Yep.
fixating on that item that I want.
Exactly. I'm the same way. Yeah, exactly.
Now, I want to ask you, I don't want to forget to ask you this. Do you
Mhm.
see, and you may not know this, but do you see differences between men and women with some of these epigenetic factors in the expression of genes?
Oh, heck yes. Great question. So, one of the actual driving factors of, epidemiologically that's associated with higher aging is being a male, being of the male sex. We've known for a really long time that men typically, undergo disease a little bit quicker than women, and they die sooner than women, unfortunately. Um, there was a study that came out recently that even talked about how that applies to biological aging. And men on average tend to be about 4 years older biologically compared to women too. So
Wow.
it's just called that, I think it's like the sex paradox, like the male female sex paradox, where we still don't really know why. It kind of just is, right? So you have to take it for just that. Mhm.
Yeah, I was just about to ask the why was the first thing
Yeah.
that came up. And I was back to the stress because I thought, well, women stress themselves out, but they talk about it more. And I know, like, if my
Oh yeah.
husband's stressed, he holds it all in.
Mhm. Yeah, definitely. I know there's like more of a scientific word for it out there somewhere. But it's, women have more of those closer relationships, right? We have our best friends, those people we would, go to jail with, be in jail with from whatever
Mhm.
you got into. Where men, on the other hand, they can take like a lot of those personality tests and different things, and they actually never have that one person who they're very extremely tight with, outside of a partner relationship. So you see that in a lot of the studies too, is they feel like they can't open up, or there's that sense of, I have to be a man. It's taboo to really talk about and open up my feelings and be emotional. So I think that's definitely part of it.
I do too. And then there's something that happens, like you have a lot of friends in your 20s, and then you meet somebody, you marry, you have your kids, and then that's when I think unknowingly start to isolate yourself because you're so busy raising a family. And so then that gets worse as we go through the decades. Because I know my husband has said to me, I don't have the friends that I used to have. Because I know when we met each other in our early 20s, we both had this huge friend group.
Right. Yeah. There were these, I forget who it was from. So I apologize. I really want to give this person credit, but there were these graphs that went popular on Twitter like a month ago that talk about, as you become older, your relationship with seeing your parents, with seeing your siblings, if you have siblings, and what happens to your friends, how your friend group decreases, but how your time with your partner increases, right? That's the person who you're spending
Mhm.
most of your life with. So the relationships in terms of, how they change across your entire lifetime becomes super interesting. And it made me really sad seeing that. Like I love my partner dearly, but it made me really sad talking about how, out of the 365 days a year, you'll probably only see your parents maybe 12 times if you're lucky, right? It
Mhm.
just those graphs really put it into perspective. But I could even feel, as I'm becoming older too, those same shifts, those same changes in terms of who I'm talking to, who I'm hanging out with, who I'm seeing, who I'm making time for, right? Time is the most precious aspect you can, ever give anyone. So it is, becomes a lot more scarce as you become older and have children.
It does. And when you have the kids, you really are so busy, you're focused on your children. You're so busy you don't realize that you're not socializing anymore, or you're maybe just, I don't know, down at the park for a play date, and that's the only socialization you have. And I know I went through that as well and felt a little isolated. And then when the kids grow up, move out, you've got to redefine your relationship with your spouse and your identity as well.
Right. Yeah. And I don't have children. I have plenty of friends who do. And yeah, you can definitely see it, right? It's not intentional by any means, but the children, they take priority. And I heard something on the radio or something the other day as well that talked about yeah, like re-knowing your partner or your spouse after, throughout all of those changes in life. And I thought that was so beautiful. I thought that was so cool how, you're changing throughout life, but you're going to re-know different parts of you, and different yeah, waves of life, essentially.
That's very true. And you can fall in love with your spouse all over again. I'm
Yeah,
a
very cool.
testimony of
Yeah, it's great.
it. So I'm going to shift gears a little bit.
Yeah.
I want to ask you about supplements because you touched on it a little bit with the DHEA. Can supplements really help to improve your biological age?
Absolutely. So the second tier, when I was talking about my totem pole, or like my pyramid, if you're thinking of like a food pyramid, you go up from the lifestyle habits to supplements. So, check mark, you have all those lifestyle factors and the way you want them. You're moving up to supplements. The supplement that has been studied the most, that's obviously very popularized in the space at the moment, is going to be vitamin D. About 4,000 to 6,000 units of vitamin D per day are going to be associated with better biological aging and a lot of the major biological age clocks available. So I would say number one recommendation by far would be that.
Yes, it's an important, actually hormone. It's very important.
Right.
What are your thoughts on creatine? Because I know the research emerging about brain health and creatine is pretty exciting.
Yeah, I talked about this the other day actually with a healthcare provider I was speaking to, and love creatine. I really need to be more consistent with it. But there's not any studies that I know of that actually look at creatine epigenetic methylation. But love it as helping, right, with the brain boosting,
Mhm.
with helping keeping on muscle mass and all those other abilities that it has. So epigenetic testing is so new, and in the interventional trials, that TRIM trial came out August of 2019. So these interventional trials are far few and in between. I would love to see some more before and afters with supplementation like the creatine.
I do think it makes a difference. When I first started coaching, the train of thought was that the supplements were the very least.
Mhm.
Up at the top, of course, was your sleep, your lifestyle, your nutrition, your exercise. And yes, I agree with that. But I think it's more important than, and especially as we get older, I think it's more important than what has been given credit for.
Yeah, definitely. No, I hope it gets studied. So any researchers are listening out there, please try and perform that study for us.
Yeah, I had added some liver supplements a couple of years ago, liver support, and it made a huge difference. And it was in the labs. You could see the improvement and all of
Yeah,
the markers. So I'm a believer. I think there's some that maybe aren't necessary or overrated for sure, but I think there's some good ones that can support our health.
definitely. Yeah.
Well, I want to be respectful of your time, Hannah. As we start to wrap up, was there anything that we didn't discuss or I didn't ask you that you'd like to share with the listeners?
This has been great. I really appreciate it. If anyone wants to know more about epigenetics, feel free to reach out to Carol or myself. Like she mentioned when she was introducing me, I created a new personal page, unaffiliated with my company called Everything Epigenetics. And there you'll be able to learn a lot more. That's actually where I met Carol. I reached out to her on Instagram, and so happy and glad that we connected. And then Carol, I know you have a discount code. So if any people listening want to get tested as well. It's just Covino, Carol's last name, and you actually get 12% off of all of the True Diagnostic products. And we can get you tested and look at some of your markers and see what's really making a difference. Remember, just aging being that number one risk factor for most all chronic disease and death. So definitely prevent rather than intervene when disease diagnosis has already happened or occurred.
I highly recommend the testing. Don't be afraid to have it done because it just gives you so much information. And then you kind of have a roadmap. This is what I need to concentrate on going forward. This is what's important.
Definitely. And an objective biomarker, right? It's data. It's not subjective. A lot of people who feel healthy or look healthy, right? They could still test and have accelerated aging.
Oh,
And then
yeah.
and you can change it, right? So it's really data driven, which is another reason I love the information.
Yes. I mean, I was surprised with a few of mine too, that there were areas of accelerated aging that I need to address. So I think it's really good to not guess and to know exactly where you stand.
Yeah, couldn't agree more.
Well, thank you so much, Hannah. We're going to put all of this in the show notes. I appreciate you coming on. It's just been a pleasure, and I'm so glad we were able to connect.
Yeah. Thanks, Carol. I appreciate your time.
And to our listeners, wherever you are in the world, we wish you every blessing. Bye for now.